In our facility, we see a large number of patients who come in overweight. Most of them are. And what we've seen is that their weight improves. Skinny individuals come in and they don't lose a significant amount of weight. Some of them lose a little bit of weight initially and then it builds back up. Individuals who are overweight lose a significant amount of weight, but everybody gets their ideal body weight. So we don't emphasize weight loss or weight gain. We emphasize first and foremost nourishing the body, getting the body optimized, more physically fit, and the body's weight will get to whatever its normal weight should be. Some people physiologically need to be thin. Some people physiologically are heavier than others. But everyone gets their ideal weight when they properly nourish the body and properly move the body. The program that we have in terms of diabetics, as well as individuals with high blood pressure and other chronic illnesses, we find that individuals, particularly diabetics, type 2 diabetics, are able to come off their medications pretty quickly. We've had individuals who, for instance, have been taking insulin for decades, are able to come off insulin within a matter of days. Individuals who have very high blood sugars and diabetic side effects like diabetic neuropathy, peripheral vascular disease. Not only does the diabetes correct, but the diabetic complications also reverse. Yes, we have a number of individuals who seek us out specifically because they've been told by their doctor or the kidney specialist that they're on the verge of needing dialysis, and so they need to get ready. They need to see the surgeon, get the vascular access, get prepared for dialysis. Unfortunately, many individuals go down that path. Some individuals are able to find us, and we actually put them on our program, and we've seen great results in individuals who are able to turn their life around and therefore improve their kidney function, preserve whatever kidney function that they have, and prevent going on to dialysis. Yes, cholesterol goes down when you're consuming foods that does not have cholesterol in it, then your cholesterol will go down. But the cholesterol issue is more complex because when our liver is responsible for cholesterol metabolism. So if the liver is sick, quote unquote, in other words, if you're consuming foods, not only animal product foods, but processed foods, anything that creates a toxic environment for the liver, that overstresses the liver, then the liver starts to malfunction. And when the liver starts to malfunction, then liver metabolism is abnormal. So cholesterol metabolism is part of liver metabolism. So dyslipidemia is what I would kind of classify all of it is a result of hepatic dysfunction. Hepatic dysfunction is a result of excess toxin ingestion. If you can ingest a lot of toxin, the liver gets disease. Most of us are familiar with the concept of alcoholism causing liver disease. So if you drink too much alcohol, you have liver disease. However, there's another aspect. If you don't drink any alcohol at all, but you eat bad food, that's a condition I refer to as bad foodahol. Bad foodahol has an adverse effect on the liver just as much, if not more so, than alcohol. And so bad foodahol leads to liver dysfunction. And so as a result of liver dysfunction, among the many things that go awry is cholesterol metabolism. Yes, kidney stones is a problem that we see a lot. And similarly with gallbladder stones, when you're forming stones, crystallizations, basically what you're dealing with is an abnormal mixtures. In other words, the body forms chemical reactions on a regular basis. And so you have precursors and substrates. And so if you have a large amount of one type of a precursor and too much of something else and too little of something else, you're going to form abnormal substances. And crystallization is one of those things. And I kind of like to explain these things sort of in a global basic explanation as opposed to saying, well, you need too much oxalate and too little of this. The body that you're consuming foods out of balance. And so you're going to have crystallization that can form in the kidney, crystallization that can form in the biliary system, and you'll have stones here just due to the abnormal biochemistry and abnormal balances. Most of this originates from consumption of animal protein. when we're getting too much acid in the blood and other types of things that throws off our biochemical balance.